Good evening, students. Today we'll make a quick review of cyanosis. Definition: bluish discoloration of skin and mucous membranes due to increased quantity of reduced hemoglobin or due to presence of abnormal hemoglobin pigments. Reduced hemoglobin more than 4 grams per deciliter, reduced hemoglobin more than 30% of total hemoglobin, or PaO2 less than 85%. Types of cyanosis: central cyanosis, peripheral cyanosis, differential cyanosis, cyanosis due to abnormal pigments, and mixed cyanosis. So central cyanosis causes cardiac, congenital cyanotic heart disease, Fallot tetralogy, Eisenmenger's complex, congestive cardiac failure. Pulmonary causes: chronic obstructive lung disease, collapse and fibrosis of lung, pulmonary AV fistula, alveolar hypoventilation, ventilation perfusion mismatch, impaired oxygen diffusion. Others: abdominal hepatopulmonary syndrome, high altitude due to low partial pressure of oxygen, hemoglobin with low affinity for oxygen like hemoglobin K. Peripheral cyanosis: reduced cardiac output, cold exposure, redistribution of blood flow from extremities, arterial obstruction, venous obstruction, increased viscosity of blood, shock, Raynaud's phenomenon. Central cyanosis versus peripheral cyanosis. Mechanism of central cyanosis is diminished arterial oxygen saturation, right to left shunts or lung disorders. Mechanism of peripheral cyanosis is diminished flow of blood to specific region or peripheral stasis. So here cyanosis is seen in skin and mucous membranes. Example: tongue, lips, cheeks. Here cyanosis is seen only in the skin. Limbs are warm, limbs are cold. Clubbing and polycythemia present. No clubbing and polycythemia. So if we apply local heat, still cyanosis persists. In case of peripheral cyanosis, if we apply local heat, cyanosis disappears. Cyanosis slightly decreases on breathing pure oxygen. Cyanosis persists even on breathing pure oxygen. So PaO2 is less than 85%. In peripheral cyanosis, PaO2 is normal, 85 to 100%. You can see here, this is a peripheral cyanosis and this is a central cyanosis. So mixed cyanosis causes are acute left ventricular failure and even mitral stenosis. You can see there will be left atrial failure and peripheral vasoconstriction. Cyanosis with abnormal pigments, methemoglobinemia, more than 1.5 grams per deciliter. Two types, hereditary and acquired. In acquired, it is due to drugs like nitrates, nitrites, and sulfonamides. Sulfhemoglobinemia, more than 0.5 grams per deciliter, and carboxyhemoglobinemia, smokers. So differential cyanosis, only of lower limbs, patent ductus arteriosus with pulmonary hypertension with right to left shunt. So in this case, cyanosis is seen only in the lower limbs. Only of upper limbs, patent ductus arteriosus with pulmonary hypertension with right to left shunt and transposition of great vessels. So here this transposition of great vessels is added. Then cyanosis of left upper limb and both lower limbs. Patent ductus arteriosus opens proximal to the origin of left subclavian artery. In this condition, you can see the left upper limb cyanosis with both lower limb cyanosis. This is differential cyanosis. You can see here, this is the patent ductus arteriosus connecting pulmonary artery to the arch of aorta. And you can see here, there is a transposition of great vessels. This is the aorta and this pulmonary artery. Pulmonary artery should open into right ventricle and aorta should be opening into left ventricle, but there is transposition of the two great vessels. And this is the normal heart, and you can see this is the coarctation of heart. You can see here there is constriction of the arch of aorta. So I am just showing you different anomalies of heart. So conditions where cyanosis does not occur, like in severe anemia, already the hemoglobin is less than 5 grams per deciliter. Even all this hemoglobin is converted to reduced hemoglobin, still it will not be sufficient enough to cause cyanosis. So there will be no cyanosis in severe anemia. And in carbon monoxide poisoning, carboxyhemoglobin prevents reduction of oxyhemoglobin and the former has a cherry red color. So that is why in this carbon monoxide poisoning there will be no cyanosis. So there is a special concept of iron replete versus iron deplete cyanosis. In case of iron replete cyanosis, iron replete cells are deformable. So compensated erythrocytosis, there will be equilibrium established with hematocrit. There will be no hyperviscosity of blood. So in case of iron deplete cyanosis, so iron deplete cells are less deformable. So there will be decompensated erythropoiesis. There will be failure to establish equilibrium with the rising hematocrit. So hyperviscosity of blood occurs. So intermittent cyanosis is seen in Epstein's anomaly. So what is this Epstein's anomaly? You can see here in large right atrium and small right ventricle due to abnormal tricuspid valve formation. So in majority of the cases, Epstein's anomaly will be associated with atrial septal defect. Thank you.